holistic health and wellness in pregnancy and postpartum. I think that I have a lot of great information for you guys, and I'm just excited to be able to be here and give you guys this resource. I know that today it can be really hard and overwhelming to think about maintaining a holistic lifestyle. Sometimes when people hear those words, they don't really know what it means. But yeah, I'm hoping to make it seem a little bit more attainable for you. So thank you all for joining, and thank you to those of you who are joining online or post this class via recording. And thank you to the Gloucester County Library for making this possible and for inviting me back to speak again. I'm honestly honored to have this opportunity. Yeah, so let's get started in this presentation. So just a little bit of background about me. My name is Dizon. I am a DONA International trained birthing doula and lactation support person. I went to school to RCSJ for health science, an associate in health science, and I'm currently in Drexel University for lactation, so to get my IBCLC. If you don't know what an IBCLC is, anytime if you've gone through pregnancy before, the lactation consultant that you will see in the hospital, that is an IBCLC. And so I'm really looking forward to be able to add that on to my list of services and to be able to advocate for my clients in that way as well. I'm also a mama to my own little boy, and being a mom is just the best. It's my favorite job that I have, and it also is what started me down the road of advocacy and just really falling in love with birth work. So it also says that I'm passionate about advocating for and assisting women and their babies during pregnancy, delivery, postpartum, and lactation. So without further ado, let's get into the nitty-gritty of this presentation. The word holistic, what does it mean exactly? I don't want to put anybody on the spot, but the word holistic is characterized by the belief that the parts of something are interconnected and can be explained only by reference to the whole. And in the realm of medicine, it's characterized by the treatment of the whole person, taking into account mental and social factors rather than just the symptoms of an illness. So that being said, we're going to look at some points within the realm of holistic wellness, and those points are going to be choosing a provider, building a wellness team, building a birth team, nutrition, hydration, hormones, and self-care and mental health, which I think is just really important. And so through all these slides, we'll talk a little bit about, in pregnancy, and then in regards to postpartum and lactation and things like that as well. So wherever you find yourself, this class can be helpful for you. Even if you are a healthcare practitioner that practices within the field of labor and delivery or something along those lines, this class can be helpful for you as well. So first up, we're going to talk about choosing a provider. Finding a provider that you feel comfortable with and confident in is an important part of pregnancy, labor, and postpartum lactation, and it can prove to be difficult. So I think that choosing a provider is probably one of the most important things. Everybody here who is watching this, obviously, I think at this point you have a provider, because usually the first thing that we do, right, is when we find out we're pregnant, is that we call our OB or our primary care doctor, schedule a pregnancy test, make sure that it's really happening, and then we schedule an appointment with a provider. Now, this is more for those of you who might not feel confident in your level of care that you're receiving from your provider. So I think the most effective way to do this is to set up phone consultations or appointments with multiple providers. Write down a list of questions you have for them and weigh your options to find a provider that most closely holds the same values and health goals as you. So again, this is just really important because I can give you guys a little bit of background on my story, went with midwives from Gentle Beginnings, and I loved my experience with them. I had a great pregnancy, perfect delivery. It was amazing, very empowering. And then postpartum, we had a lot of issues with my son and kind of like a traumatic experience. And due to some things that were going on in the world, at that point, we were not allowed to see our son in the NICU for close to 7-ish days. My provider team, my midwives, called the hospital where my son was every single day to try to get us in to see him because they knew how important it was for our son to be able to be with his parents while he was in the NICU. How important it was for lactation, how important it was for me postpartum, and all of that stuff. So they really advocated for me very well during that period, and that's also what made me so passionate about advocating for other women during their pregnancy and postpartum periods of time. And so finding a provider that will do those things for you, and that you also feel comfortable telling, I don't feel mentally okay, I don't feel emotionally okay, I'm having, these thoughts, I'm struggling with this, in your pregnancy, in your postpartum period of time, and during lactation, having a provider that you feel really comfortable and confident with is majorly important, and so that can make a huge difference in pregnancy and postpartum. So if you don't feel that way and supported in that way during your pregnancy or postpartum, it's okay for you to fire that provider. I'm sure there's less intense words to use than fire, but you have to remember your provider team works for you. This is your pregnancy, this is your birth experience, this is not theirs. And so you have the opportunity and the ability and the right to say, you know what, this isn't working out. Our visions for my birth, they're not really aligning. Our values are not really aligning. Our health goals aren't really aligning. And find someone else who will align with those goals and those values, okay? So I think that's important. We're gonna talk a little bit more about this in a minute as well, but I just wanted to move the camera a bit. I just wanted to talk about that as well right now, just because I think it's really important to put a lot of emphasis on this part of care. Okay, building your wellness team. So this is really fun. This is where it gets fun. I don't know if you saw it already, but I did print off, I did have the library printed off for me, some of these resources, and I have like a whole list of really awesome providers that I know and resources within the community that can be really helpful to you. So some of the things that I'll mention in these slides, I also have a sheet that you can take home with you, or if you're watching online, you can, I will post this exact resource along with this video recording, and we can kind of, you can talk to me a little bit more about it if you have questions, or at the bottom it says like, if you want more resources, please contact me. You can also reach out to me if there's anything in these slides that you don't see on this paper and you're like, hey, what's that? I want a little bit more information. I have a lot of resources within the community, within the birthing community, pregnancy community, and just wellness community in general, the holistic wellness community. So if that sounds like something that you'd be interested in, definitely contact me. Don't hesitate to reach out, and also take advantage of these resources because these practitioners and people are just really great. So, building a wellness team. What does that even mean, right? Like, what is a wellness team? It's just a team of people, maybe from different types of practices, to help you have the most comfortable and the best experience during your pregnancy and birth, and postpartum experience. So we're building a team of people to help us have the most empowered, advocated, healthy birthing experience and postpartum experience possible. Some of those providers will include things like chiropractic care. Chiropractic care is really great for central nervous system alignment and for relief from things like sciatic pain, round ligament pain, if you have pubic symphysis dysfunction. Things like that, chiropractic care would be really, really helpful for you. Also, pelvic floor therapy in those cases would be really helpful for you as well. I don't know why I didn't mention that because that's a huge one within the realm of birth. Massage therapy. massage therapy, it sounds like a luxury, right? But it's actually really attainable. And I think that some insurance companies actually cover that during pregnancy because it is such an intensive thing that happens to our body, and massage therapy really helps us to be able to recover and also to stay loose for delivery. That's something that's very important. For relief from muscle pain and tension, and to help keep the body loose to prepare for labor, which I said. Another one is nutrition response testing, NRT practitioners. This is a big one, and I didn't know anything about this personally. My sister is the one who told me about this, but I think it's super helpful now knowing what I know about it and having been to a nutrition response testing practitioner myself and just experiencing it's the coolest experience ever. But it really does help a whole myriad of issues, right? Because NRT practitioners are actually kind of speaking to your central nervous system and seeing what your body needs, where your body is lacking, where your body needs some support. And that can be really important during pregnancies because, and postpartum, because now you have all of these deficiencies, you have all of these crazy hormone levels and stuff, so we need to be able to support the body the best way that we can. I think NRT, nutrition response testing, is a great way to do that. And also they help you to be able to support your body nutritionally as well, but also with supplements if that is necessary. And we'll talk a bit more about like supplementation and stuff later. Another one that kind of goes in line with NRT but is pretty different is like a nutritionist or a dietitian. I wouldn't say so much dietitian. That is kind of for like pretty specific situations and medical conditions, but nutritionists, especially holistic nutritionists, very important during pregnancy, very important postpartum, because we need to support our body nutritionally, especially and during lactation as well. And again, we will talk about that a little bit more in depth later. But yeah, it's very important to be able to support our body nutritionally throughout the duration of pregnancy and postpartum. And so you might see a nutritionist or a dietitian to establish and maintain a healthy diet filled with nutrient-dense foods and to prevent deficiencies in certain areas or treat deficiencies. And then lastly on this slide is CST, craniosacrofacial therapy, and that is something, again, not many people have heard of, but it is super helpful, especially postpartum, especially for breastfeeding. If your baby has a lip, tongue, buccal tie, or high, narrow palate, things like that, that might actually hinder lactation, breastfeeding, milk supply, things like that. Having a CST available to you will make a world of difference. My son has seen a CST not as frequently as we would have liked, just because life got hectic. But we definitely need to take him back, and I need to go for myself. CST does some amazing things within the body, and yeah. So if you, again, I'm just going to throw this out there because I don't think I mentioned this later in the slides, but if you have a child, if you're postpartum now and you kind of like are noticing some signs of like a lip tongue, oral tie, CST is really helpful because an oral tie, like a tongue tie, is actually a tight band of fascia that runs from your tongue down to your toes. So it can actually hinder lactation and milk supply, but it can also affect things later in life, like dental hygiene, and also like crawling and walking and things like that, developmental milestones. So it's really important to have a craniosacrofacial therapy help you work through that and then maybe get that tie revised. So if you have some more questions about that, please make a note, write that down, and feel free to contact me about that, and I'll love to give you some more information. But yes, the CST can relieve tension within the body's fascia. This technique can also help people work through various types of trauma that are stored within the body. So, and then some of these, I just have to say this, some of these might be covered by insurance, some of them aren't. I have a lot of great practitioner friends that I know that are really affordable even if they don't take insurance. So, definitely don't hesitate to reach out if you feel like you need a resource like this, because all of these things are very, very important. And I know it can feel like they're unattainable, but actually, a lot of these practitioners will work with you. And yeah, so, but some of these are covered by insurance. And if you have like a specific insurance, or you're not sure if they're covered, you can always contact your insurance company and find out what is available for you in pregnancy and postpartum. Next up, building your birthing team. And this is also an exciting one because these are the people that are going to help you facilitate the birth and postpartum experience that you want, your ideal birth. And I always say, like, the perfect birthing experience is one that you feel comfortable in, confident in, and that makes you feel really empowered and like you were advocated well for. So whatever that looks like to you, regardless of the method that it takes, if you feel like you were supported through your birth and through your pregnancy, postpartum, lactation, and all that stuff, and you feel like you were really empowered and things like that, chances are you had a really great birth team, and it's great to duplicate that for the next birth and so on. So building your birth team, assembling the right team to support and advocate for you, your spouse, and your baby is incredibly important, can make a world of difference. There are much higher rates of positive birth outcomes when the birth is accompanied by someone like a doula, and a significant decrease in C-section and other interventions with use of a midwife. So I don't know if you guys knew that, but there are statistics. Down here you'll see the presence of a doula has been proven to decrease the overall cesarean rate by over 52%, the length of labor by 25%, and the use of oxytocin by 40%, and requests for an epidural by 60%. So if you plan on going unmedicated, having a physiological birth, hit me up because I can definitely talk you through some more of those points. I don't want to make it too isolating for, because I don't know where everybody is in regards to their pregnancy and what they plan on doing for their birth. But definitely, teams, having some of these providers on your birth team can really help facilitate those births. But even if you're planning on having an epidural, if you're planning on having a planned C-section, a doula, a midwife, definitely like a doula, postpartum doula, lactation support person, lactation consultant, those kind of things can really help you through your birth as well. And so that can really help you during your birthing experience. And there's just different ways that we can do that. Different positionings that can be used for that are epidural friendly, and then just like emotional and physical support during cesarean section, and support for your spouse as well. So that can be really helpful to a lot of people as well. Some other people that are honorable mentions, very important for building your birth team: midwives, birthing doula, postpartum doula, lactation support, lactation consultant. Again, some of these are covered by insurance. Birthing doulas, depending on where they got certified, are usually covered. Birthing doulas certified through DONA International are usually covered by most major insurances, including state insurance. A lot of state insurance plans cover birthing doulas as well. Lactation support is also usually covered by insurances, but you can call your insurance company and see, or the actual provider themselves, and see if they take your insurance. Now on to nutrition. So we're going to hit on this later, so this is later. Maintaining proper nutrition before, during, and after pregnancy and while breastfeeding is crucial for supporting your pregnancy, body, and maintaining food supply. So that's very factual based, and we know that as lactation, in the lactation realm, in the birth realm, that certain things that are nutrition related, like nutrient deficiencies and things like that, can actually affect pregnancy, postpartum, and lactation period. Maintaining nutrients like iron, protein, and healthy fats while pregnant is incredibly crucial for the development of the baby. There are links between protein deficiencies and lack of muscle tone in babies, which can ultimately cause difficulty meeting developmental milestones, like turning over, crawling, walking, etc. later in life. So I don't know if you guys knew that, but that is very important. And another thing, like healthy fats and things like that, that can also lend itself into, like if you don't have, a good reserve of those, and if you're deficient in those as well, that can also affect those milestones later. Later on, according to the NIH, iron deficiencies and anemia during the postpartum period may have long-term health implications for the mother and her infant. Mothers with low iron stores at the time of delivery and following childbirth may experience fatigue, altered cognition, and depressive symptoms. Additionally, during the lactation period, nursing mothers need to consume an average of 500 extra calories each day due to rapidly burning calories while breastfeeding. Not doing so can result in low energy levels, altered cognition, dizziness, slower metabolism, and low milk supply. So if you're one of those people that think like, oh, I'm breastfeeding, I'm going to lose all this weight, I'm not going to be as hungry, so I'm going to be like, I'm going to be not eating as much because I want to get my pre-baby weight back or whatever the case is, don't do that. That's very unhealthy, and it's not good for your milk supply either if you plan on breastfeeding. That's like a huge no-no. And also, you're going to get like dizzy and stuff like that. You don't want that, okay? You're already going to be, struggling, to maintain proper sleep patterns and stuff like that, just because of like postpartum, some of the effects of postpartum and stuff like that. But you don't want to aid into that by not eating. Again, you want to maintain a nice nutrient-dense diet in order to support your body and all of its needs. And then I did say I was going to mention this later as well. I do encourage supplementation where it may be difficult to maintain certain nutrients in your diet. However, I only recommend supplementing under the supervision of a provider like an NRT practitioner or your primary care doctor, and only after blood panels are pulled in order to properly assess where you have deficiencies. So if something is a little bit harder for you and you know right off the bat, like this is hard for me to maintain my iron levels, or I am anemic, or whatever the case is, like that is something that you would have blood panels pulled for. And once that is confirmed with a practitioner, supplementation under the guidance of a practitioner is always a great option. But if you can get that nutrients, and those needs met through nutrition, that's always the best option. Next up is hydration. So we're going to talk about a couple different things in here. I did post about this on my Instagram if you follow me on my Instagram pretty recently. But this is just really important. I wanted to hit on this because there's some misconceptions within the realm of hydration, especially as it pertains to lactation. Maintaining hydration and electrolyte balance during pregnancy is incredibly important for maintaining amniotic fluid levels as well as energy levels during pregnancy. Maintaining hydration postpartum and while breastfeeding is also incredibly important, as a low electrolyte balance and hydration levels can affect both energy levels and milk production. However, this is the stipulation, there are also dangers to overhydrating. Overhydration can lead to water intoxication. Essentially, drinking too much water will deplete electrolytes and sodium levels to a dangerous level, which can lead to seizures, nausea, vomiting, confusion, coma, and even death in extreme cases. In addition to this, overhydration, messing with electrolyte and sodium levels in the body, can actually deplete milk supply. So one of the most frequent things that I see on Reddit forums and things like that are concerned moms looking to boost their milk supply. And one of the top things that people say, drink more water, drink more water, drink Propel, drink Gatorade, drink all of these electrolyte solutions, drink liquid IV, drink all these things, right? And people are really pushing hydration, which is great. We want to stay hydrated. However, an excess in overhydration can actually really hinder your milk supply. And we know that because it really just messes with the electrolyte balance in the body, and the sodium levels as well. And so your body thinks, I have all this extra hydration, I just need to excrete it, and so you pee it out, instead of that hydration being utilized to produce more breast milk in the body. So you can maintain electrolyte balance by eating electrolyte-rich foods like bananas, avocados, sweet potatoes, spinach, beans, yogurts, oranges, and more. Maintaining healthy sodium intake levels, pushing electrolytes after exercise while sick and when you're sweating, watching your urine color, okay? There is also a misconception about urine color. I bet you didn't think that you were going to watch this and that you were going to hear a bunch about pee, but here we are. It's important. Completely clear urine is not a good thing, as maybe you have had previously thought, okay? It doesn't mean you're doing great with drinking water and you're it actually means you're overhydrated. It's a sign of overhydration. Urine should never be completely clear. It should always have a slight yellow tinge to it, always. So if you are peeing and your urine is clear, chances are you are pushing hydration a little too much. Cut back a little bit. In that case, you should be drinking to thirst and not drinking to maintain a hydration goal. I think that that's something that we got into for some reason, like these big, giant hydro jugs or whatever with like different times on it. I need to drink this much by this time, blah, blah, blah. And you have like this huge honking bottle, and like people are bringing all these gallons of water with them to the gym. And so if you're exercising and or it's extra hot out or something, yes, you are going to need a little bit of extra hydration. However, we should never be drinking excess amounts of fluid in order to maintain a hydration goal, unless you know for a fact that you're severely dehydrated or like you're underhydrated, you're not drinking enough. Then it's okay to just like, be like, all right, I need to kind of drink a little bit more. But you should never be pushing yourself to the point where you're feeling nauseous or sick after drinking too much water. You're feeling your stomach's overly full, you're feeling uncomfortable, or your urine is clear. None of that's a good thing. We also know that excess IV fluids during labor can delay lactogenesis too, which is the second stage of lactation, where breast milk supply is really established. And it is important for you to advocate for yourself in labor. So if you know right off the bat you're getting an epidural, or you're having a cesarean, or whatever the case is, okay? Even if you're going natural or unmedicated, I should say. Sorry. Even if you're going unmedicated, or whatever method your birth is going to take, typically you will get an IV lock at that, when you go into labor or you go into the hospital, and they will try to, pop in some IV fluids. Excess IV fluids have been proven to hinder lactogenesis too, delay lactogenesis too, which is the second stage of lactation where your hormone supply is really established. So, so we don't want to do that. We don't want to delay lactation, and we don't want to delay our body's natural process of producing, and really maintaining, building that supply initially. So in order to do that, it's okay to advocate for yourself and say, I'm cool with a little bit of like IV fluids, but like when we're on like, I'm just gone through like an entire bag, maybe it's going a little too fast, or maybe, I don't want a second bag right now, or, and things like that. And also skin to skin contact, very important immediately after birth in order to establish your milk supply. So advocate for that for yourself. If you don't have a birth doula, you are the person, you're the point of contact, right, in the hospital to be able to say like, I don't want this or I do want this, and you're allowed to say that. Hormones. This is a big one, guys. This is really important. Okay, and this is something that's not, I was almost not going to add this to my presentation. I was like, why am I not going to add that? Because that's something that I was so frustrated in myself when I had my son. I had no idea, especially the first time mom, how are you supposed to know the science and the anatomy and physiology behind all of this, behind birth? Like, you just don't. Unless you're like attending crazy classes or you're going to school for this stuff, like you really wouldn't know that. Everybody knows probably that, right, that hormones are affected during pregnancy and birth and postpartum. But the way that we maintain hormone balance is not really known. It's not really talked about. And this should be something that providers push to their clients, to their patients. I don't know why it's not, because this is the thing that lends most into postpartum depression, anxiety was hormone hormone imbalance. I'm sorry. Chest club is really great. All right. So anyway, where were we? Hormones. Why are they important? According to the NIH, hormones act as catalysts for chemical changes at the cellular level that are necessary for growth, development, and energy. During pregnancy, hormone regulation is incredibly important for proper growth of the baby, expansion of the uterus, development of baby's organs, relaxing ligaments in the body in preparation for labor, getting the body ready to produce the colostrum of breast milk, supporting production of blood vessels, and so much more. That's not even close to being it, but that is, those are some of the big things, Postpartum. In the postpartum period, hormone levels plummet within the body. They plummet dramatically. Without proper support from an endocrinologist and a holistic healthcare practitioner, followed by proper blood panels This sudden decrease in hormones can lead to mood swings, hot flashes, irritability, vaginal dryness, insomnia, fatigue, weight gain, hair loss, and can contribute significantly to postpartum depression and anxiety. Many of these issues will not be remedied until proper hormonal balance is restored in the body. So I don't think a lot of people know that. We all, like I said, most of us know that hormones are very important during pregnancy and postpartum. We don't know why, right? We're not taught that. Providers don't like just like hand out that information. It's not like one of their, things that they give you in your pregnancy folder at the hospital or at their office. But it's very important. And so getting seen by someone like an NRT practitioner, or someone, especially postpartum, guys, this is like very important, because your body's hormone levels are like at this crazy all-time like high during pregnancy, right? And then postpartum, they plummet. And that change is what lends itself the most. Like I said, there's probably other, environmental factors and stuff, but this is, probably what lends the most into PPA and PPD. And so working with an endocrinologist or someone, that will, even your primary care provider, if you just don't even know where to start, that's fine. Go to your primary care provider and just say, like, I think I want some hormone panels pulled. You can do that during pregnancy and you can do that during postpartum to make sure that you're where you need to be. And if you're not, you can go through your provider in order to figure out how to get there. But some of the ways that you can do that naturally and support your hormone balance is, again, by getting those panels drawn through an endocrinologist, your primary care provider, or under the supervision of someone like an NRT practitioner, followed by replenishing depleted nutrient levels where needed, whether that's, like I said, eating a nutrient-dense diet and a balanced diet, or through supplementation if you really feel like you can't maintain those levels. And then getting more sleep and exercising are other ways that you can also help your hormones. But there are more ways. Like, again, if you have any other questions specifically regarding any of these slides, especially hormone balance, please reach out to me and I can connect you with other resources within the community, or I can, answer whatever questions I can myself. But this is very, very important. Mental health and self-care. I put these on the same slide because I feel like they kind of lend themselves to each other. They're very, they're important to each other, but they are separate things. So mental health, pregnancy, postpartum, and breastfeeding can all take a huge toll on your mental health. And if you've had a baby before, you know that is very true. Especially if it is, even if you haven't, if you're just pregnant, you probably know that already. If you haven't cried over, your husband getting their own jar of pickles like I have, then you're having an interesting pregnancy, free from, I guess, emotional insanity, which I was not in that case. But anyway, especially if there is a hormonal imbalance present within the body, this can be really, really difficult to maintain proper, and good mental health conditions. You can help maintain good mental health conditions by getting connected with support groups, hormonals within your community. Again, I have some of those support groups listed on our resource sheet. So if you'd like to just give that, check that out, it's at the very bottom. Seeing a therapist, this is very important. Again, this is another resource that is usually covered by insurance companies. So you can always call your insurance company or call a provider to see if they take your insurance. But 9 times out of 10, your insurance will cover all or most of a therapy visit, weekly therapy sessions, especially postpartum. And your provider, if you have a great provider, they will, I believe all providers have to do this, I'm not sure. I don't know for sure, but most providers, I do know they do like a mental health evaluation afterwards, but a lot of people aren't honest on those, right? Like, what, I think that people fear what a practitioner would do if we said, like, no, I'm not okay. You know what I mean? Like, are they going to take my kids away? Are they going to, like, what's going to happen? That's not, we need to be open and transparent about our mental health, because that is the only way that we can get the help and support that we need, is if we're very transparent about what we need and very verbal and vocal about what we need. If you don't have a support system, if you feel like you don't have, if you don't have a spouse or a partner, you don't have, family and friends that you feel like are supportive, and you don't have like a church community or something like that, this can be really especially difficult for you. And opening up to just like a random person can be really hard, but especially when you're seeing a therapist, these people are not there to judge you. They're not judging you. They're there to help you. That they're in this field, not for the money, not for the money. They're in the field because they love to help people and they want to be there for people who need them and they want to be able to provide them with resources. And a lot of them will have probably experienced this themselves. So don't be afraid to be open and vulnerable about what you need, because that is the only way to truly get help. And that's how you can make sure that you're the best mom and partner that you can be. Anyway, talking to your healthcare provider and letting them know if you have a family history of PPA or PPD. Usually, and this isn't always the case, but sometimes PPA and PPD are more prevalent in hereditary patterns, I want to say. Like, it's definitely not like solidified in stone. Like some people who, maybe their mom has experienced like a really severe postpartum depression, they might not experience postpartum depression at all, and vice versa. So it's not directly linked, but it is correlated. So definitely let them know if you have a family history of that, if you are pregnant, and they should, if you have a great provider, they will keep up with you throughout the pregnancy and see how you're doing, and then postpartum as well. Communicating expectations and needs with your partner, which we should all just be doing anyway, right? But it can be hard, especially because your partner, men don't know. They don't know what we go through, right? Like they're going through the process like in their own way, but they're not having all the like hormone depletions and all of these crazy things that we're going through and experiencing in our body. So being very open and vocal about that and explaining it, and maybe even like if your husband is somebody who like really likes to have like the scientific explanations behind things and stuff like that, doing a simple Google search will appease him. You know what I mean? So just definitely don't be afraid to be vocal about what you need, even if you think that they're not going to support you. You'll be surprised, right? And that's the only way that we can find that out is by actually speaking to them and letting them know what we need from them. And then establishing a good support system. This can consist of family, friends, local church, your local church, support groups, etc. And do not be afraid to be vocal about what you need and where you need support. I mentioned this multiple times already, and I probably won't stop here because it is so important to communicate. You cannot just expect others to know how you're feeling, and you cannot it's so important to not hide how you're feeling because you're embarrassed, because you don't want to be vulnerable, you don't want to open up. Maybe you come from a family where, it's really hard to open up to other people, and it's kind of frowned upon to go to a therapist. Maybe your family thinks, you grew up thinking that meant that people were crazy or something like that. It's just that's not true at all. I believe that everybody needs a therapist because we're all human and we're all struggling in some way, shape, or form. So be vocal about what you need. Reach out to people for help. You can't bottle it all up because that's when destruction happens. Like that's when just really it gets harder and harder for people to maintain their mental health. And now self-care, the fun part of mental health. Self-care is extremely important while pregnant and during the postpartum lactation period. I know for me, it was very hard for me to try and get into self-care methods while I was pregnant. Not so much while I was pregnant, I'm sorry, postpartum, because I didn't want to leave my baby's side. I had I had a lot of postpartum anxiety. I had that mom guilt, you know what I mean? If anybody has ever experienced that, I had mom guilt, severe mom guilt. And just make sure that this is still pretty cool. Sorry guys. Yeah, but you have to understand, without you giving yourself the time and effort that you need, you can't be the best mom and wife. You just can't. You have to give into yourself a little bit. If you're constantly pouring out to others and not filling yourself back up, you're pouring from an empty cup. You're gonna get exhausted, you're gonna get burnt out, and you're gonna feel this. You're gonna feel poor mental health outcomes. So, very important, make time for yourself to do things that you love. And if you don't know what you love anymore, because motherhood makes us question our whole identities, and it just makes us think like, who even am I? It's okay to try new things. It's okay to try new things and to see what you like now and who you are now and what helps you to get into that good headspace now. It is another way that you can support your mental health. It can be easy to lose yourself or your individuality during pregnancy and postpartum. Taking time for yourself to do things that make you feel pampered and relaxed can work to relieve symptoms of postpartum anxiety and postpartum depression. It can contribute to overall positive mental health conditions, can reduce overstimulation and irritability. That's something that's huge for me right now. So I don't know if anybody else gets super overstimulated and then gets irritable. That's me. Maybe I'm just talking about myself. And then can help you be the best mom and significant other that you can be. Self-care may look like, to do just a few things, obviously it can look like a variety of different things. Like baking, it can look like baking. If you like, going on intense runs, I don't know why you would like that, but that can be self-care too, I guess. But yeah, so taking time to do things you love, like listening to podcasts or music, crafting, reading, writing, etc. Pampering yourself, doing your nails, getting a massage, taking a long bath, taking time to apply some holistic skincare. I also have some resources for that as well if you're interested, just because this is a holistic health and wellness seminar. And if you have any questions about why holistic skincare, you can also message me and I will answer any questions about that. Exercising, working out at home, outside, or at the gym. If you're like, no way, maybe a fitness class with a friend could be fun. Walking on a treadmill or at the park, etc. I feel like park walks are like the best therapy for me, aside from actually talking to my real therapist. But yeah, especially when it's nice out, the weather's getting nice out now, you have an extra hour of sunlight or whatever it is. So take advantage and get outside. Even if pregnant, postpartum, whatever, focus on things that make you feel like yourself and make you feel happy, make you feel like you're pouring something back into yourself, okay? So I'm gonna open up for questions actually later because I want to maintain confidentiality. So after I pause the recording, I will take some questions. If you have any questions and you're watching virtually, you can DM me on @wellnessandwomb on Instagram, or you can email me at wellnessandwomb@outlook.com. Or if you have my number, you can call me. But yeah, so if you're here in person, grab a resource. We have great resources that the library printed out for us. They have a lot of the practitioners that we talked about, some of my favorites in the area. And then if you are virtual, take a look at my resource list, which will be posted with this recording. So thank you so much that's it actually. Thank you so much for